I've come here today to talk about a subject which is very, very dear to my heart. As you can tell, I'm interested in women of all ages, but owing to my own age, shall I put it, I'm getting more interested in the spectrum of what happens to us girls as we go through the change and into the menopause. Now, we all know that we live through lots of different life stages, and obviously we have done for a long, long time, because this is a 15th, 16th century, absolutely wonderful picture of the different stages of life of every woman. And I wish that I was still down on the other side. I know, of course, I'm up at this side with the Grim Reaper looking over my shoulder now. But the interesting thing, of course, is as we go through the menopause and the change, and of course the word menopause comes from the Greek for the end of menses. That's all it means. And none of us are sad to see the end of menses, are we? We're looking forward to those wonderful years of our life when we don't have to put up with that any longer. But we all know that until about 10 years ago, perhaps, the message was this, that as you started to change, and I'll show you this in more detail, and as you started to get older, you would be brought and led through the fountain of life, the elixir of youth, and you would come out rejuvenated at the other side by the judicious use of some HRT. Now, we all know, of course, that the story since then has changed quite dramatically, and that what the press are telling us and what our own doctors are telling us is that, in fact, we're tough old birds. We must get through that change in life. We mustn't interfere with a natural process. And in fact, HRT causes more harm than it does good. This wasn't the story until recently. So how does we as women make a choice? How do we know where the information is? And that's my job, because we all ride a hormonal roller coaster in those perimenopausal years. And the menopause, the end of periods, doesn't happen suddenly. It's not a one-off event. We have many, many years when our ovarian function starts to change. So all of us will live through the perimenopause and hopefully into the postmenopausal years. And we need to understand what's going on. Now, any woman who's been in her mid-40s will know that she has some months when she feels normal and some months when she feels slightly less than normal, and that she rides a sort of roller coaster through that period of her life. If I were a gynecologist, and I'm not, then I might only concentrate on what happens to our periods. And I might be interested in asking about your cycle length. Are your periods getting closer? Are they getting further apart? And I think it's a myth, because I think most women grow up thinking that that will be the primary change that they see as they come into the menopause, that things will start to go wrong first with their periods. But in fact, what women come to see me with are other, much more subtle changes rather than just their menstrual problems. They tend to come with a constellation of symptoms which usually revolves around the premenstrual part of their cycle. So that even if women have never had PMS when they were younger, they suddenly develop it in their mid-40s. And women who have had PMS find it gets much, much worse. So women come to me saying, I'm awful, I'm irrational, I'm angry, I'm irritable, I'm paranoid. I think my work colleagues are talking about me behind my back. I think my children are talking about me behind my back. Well, of course, that's not paranoia. That's real, because our children... Never mind. And women with appalling premenstrual and menstrual migraine. The peak age of presentation at the London Migraine Clinic, this huge centre of excellence, is 42 in the perimenopause, when suddenly women are no longer able to cope with their migraines. Huge numbers of women in the perimenopause feel appallingly tired, as though a blanket has been dropped over them. And one of the main reasons for that is the incredibly poor sleep that we develop. Women present with joint aches, with flu-like symptoms, with terrible concentration, with appalling verbal memory. And interestingly, you see, you all know that one. We gradually lose over time the ability to remember names and nouns. So we can do whole sentences, but we can't remember the name of the thingamy over there. We lose libido, sex drive, we lose loss of drive and general get up and go and generally the will to live. And we lose the ability to multitask, which is what sets us aside from men. Don't we wish we could say, no, I'll do that in a minute when I've just finished doing this, because we do 14 things at the same time and then find we've put the socks in the fridge and the milk in the washing machine. And generally, we lose the ability to cope. Now, you've had enough now, but of course, one of the main problems is that if you go with this constellation of symptoms and you have the courage to ask anyone for help, what you tend to be told is, well, it's that time of life, and your children are leaving home, and you've got empty nest syndrome, and you're not coping terribly well, and you're depressed. And so huge numbers of women at this stage of life, in the perimenopause in their 40s, are actually given the label of depression and antidepressants. And that adds to the declining feelings of self-worth. What women want to know is this normal? For many women, that may be enough. They may not want to intervene. They want to know whether this is normal or am I going stark, staring, raving mad? Because that's how you feel. Now, I'm not actually trying to be sexist about this, but if you do go to your doctors or you go to anyone and you say, is this normal? Am I going mad? And you get met with a sort of blank, I don't know. I'm sure this could have been a female just as easily, but I couldn't find a picture of a bald, very bemused-looking woman. But the point is that we need information. We need to know more about this. We should be better prepared for this. Why do women not know when the average age of the menopause is? We've done a survey recently, and we've discovered that most women think it's much older than it is. What is the age, do you think, you girls out there, is the average age of the last period of women in this country? Actually, that's a very low, it's 51. 51 and a half. But most women that we surveyed actually thought it was mid-50s, 55 upwards. Now, that's interesting because if you ask younger women, they tend to think that it's about mid-50s. They don't realise. And they certainly don't know what the perimenopause is and that there are years and years leading up to that last period. Now, what we need to know really is what does go on after the menopause. Most of us will recognise that we get that sort of constellation of symptoms during the menopausal transition. And I haven't even talked about hot sweats and night sweats and hot flushes because I don't need to, because you all know about those, or will do at some stage. But we also need to know what are the consequences of becoming post-menopausal. Because we live in two different eras in our life, really. We live with estrogen in the premenopause, and we live without estrogen in the postmenopause. And we never used to. In 1900, the average age of the menopause was 47, and the average life expectancy of women in the UK was 49. So now the average age of the menopause is 51 and a half, 52, and the average life expectancy of women in the UK is around 80, which is to do with better healthcare and better nutrition and everything else, and we're very delighted about that. But does that mean it's natural? I'm not saying it's not. I'm saying it means that we enter an era of our life when we have a hormonal choice, and we need to know how to make that. Now, without estrogen, we will get some symptoms in what I call the medium term. And in fact, interestingly, that's mainly to do with our bladder, our waterworks, and our genital tract. Don't we love that word? Our vagina and our vulvas, ladies. And the tube that we wee through, the urethra, and the bladder, and the pelvic floor. And I'm going to be talking a lot more about this towards the end of today's talk. But basically, in the perimenopause, a lot of women will start to develop urethral syndrome, this feeling of needing to go to the loo very, very often and having to get there very, very, very quickly. Latchkey incontinence. As soon as you get your key in the front door, you don't know what to do. And you go to the loo and you empty your bladder and then you think, oh, damn, I've got to go again, constantly, over and over again. Now, genuine stress incontinence, that terrible thing where you wet yourself when you increase your abdominal pressure if you cough or you sneeze, that doesn't respond to just estrogen alone, but in fact a little bit of estrogen along with all the other things for stress incontinence can help. But definitely one of the things that happens with estrogen depletion is that we start to get recurrent waterworks infections as well. And that can start to happen in the middle years, perhaps 10 years, 15 years after the menopause. In the vagina, we all know that it may well become dry and that therefore sex can become painful. We know a little bit less about prolapse. If I talk to women about prolapse, they generally think that I mean that their womb has appeared in a horrible kind of way. And in fact, most of us will suffer from a degree of prolapse, which is just to do with the trampoline, which has kept everything supported down below in the pelvic floor, becoming a little bit more like a string shopping bag. And so things will start to bulge. And very often it's the walls of the vagina that will bulge, not the womb, but just the walls. But it will give us a feeling of dragging and unpleasantness that we really don't have to live with or want to live with. But virtually nobody tells us that our normal vaginal secretions, the things that have kept our vagina lubricated and moist, will start to change. And that purely because of lack of estrogen, the good bug which keeps our vaginal secretions healthy and normal will become depleted, and we get an overgrowth of mixed bugs. This is nothing to do with sex and those ghastly STIs. This is to do with our own bugs inside our own vaginal secretions. So you get a dry vaginal wall with non-lubricant secretions which can become smelly and sore and unpainful. How many of us were told about that?